We have three different examples here of ways to talk about CPR with patients in the hospital. Anytime you talk about CPR, you really need to first define what are the patient's expectations about what might happen in the future or what might be the most desirable outcomes in the future. So the first example is, if you've already talked about that and you recognize that based on what the patient has told you about what they think about their future treatments, that CPR is probably inappropriate. Here's a way to phrase that conversation from there on. Mr. Jones, you've told me that your goals are to have the best quality of life that you can, but that you do not want any more cancer surgeries or chemotherapy. So with this in mind, I do not recommend the use of artificial or heroic means to keep you alive at the time when death comes. I suggest that I should write an order in the chart such that when you die, when your heart stops beating, we'll leave it stopped. No attempt will be made to restart it. Does that seem appropriate to you? The next example is from when CPR might be medically appropriate and it might be consistent with the patient's goals or wishes. You need to find out. So here's an example. Mr. Jones, we've discussed your current illness. Have you given any thought to how you would want to be cared for at the time of death? Sometimes when people die or are close to death, especially from a sudden illness, life support measures are used to try to bring them back. On the other hand, we can focus on keeping you comfortable at the time of death and not try to restart your heart. Have you thought about this at all? Do you have any feelings or opinions about it? And in the third example, when CPR is requested but might not be medically appropriate, for example, in a patient where death is expected from a chronic life-limiting illness such as advanced metastatic cancer or renal failure on dialysis, multi-organ system failure, advanced dementia, or end-stage liver or cardiac disease, I think it's usually best to start not with asking, do you want us to try to restart your heart if it stops? But start with a different question. Tell me a bit about what you know about CPR, Mr. Jones. What do you expect will happen? What do you think would be done differently after our attempt at resuscitation, if it works, that wasn't being done before your heart stopped? You know that we are doing everything that we possibly can to keep you from ending up in a situation where your heart no longer can work. Do you have some thoughts that something might be different if some attempt was made to resuscitate you that might be different from what we've tried before? If you decide that you're going to go along with Mr. Jones's request to have a full code, the next question you really also need to ask is this one. Mr. Jones, I understand your desire for CPR, but I need some more direction about what to do if you survive the CPR, since you'll most likely be on a breathing machine in the intensive care unit. It's likely you will not be able to make decisions for yourself at that point. Who do you want to make decisions for you about your medical care? Who do you want to be talking to the doctors? It would be helpful if that person and the doctors have some sense of how long we should continue life support measures if you're not able to make decisions and if there's no improvement in your condition.